Hello everyone, my name is Taylor Perna. I currently practice in Connecticut. I've been a nurse now for about 10 years. 10 years? Yep, 10 years. I have had an extensive background, first starting with med-surg, then moving over to the emergency room and then ICU, and have been in dialysis for a little bit of time now. Currently, I work as a regional clinical manager in the acute setting. In this role, I collaborate with nephrologists, hospitalists, nurses, other members of the interdisciplinary team to coordinate care for our hospitalized patients. Again, more so in the acute sector, so only dealing in the hospital setting. It's definitely strengthened my assessment skills, clinical judgment, and ability to recognize changes in patient conditions quickly. I've chosen to pursue the family nurse practitioner track because I enjoy caring for patients throughout the lifespan and want to focus more on preventative care, chronic disease management, and patient education. I look forward to building long-term relationships with patients and helping them improve their overall health through evidence-based practice and health promotion. For today's discussion, I chose a very common primary care complaint, dysuria. My patient is a 20-year-old female who presents to the clinic complaining of burning sensation when she urinates. She tells me that her symptoms began about 2 days ago and came on fairly suddenly. Since they started, the burning has remained consistent and occurs every time she voids. When I ask her to describe the pain, she says it feels like a burning and stinging sensation that is localized to the urethral area and does not radiate anywhere else. She rates her pain as a 6 out of 10, explaining while it is tolerable, it has become uncomfortable enough that she wanted to seek medical care. She reports that urinating makes the discomfort worse, while drinking water has provided only minimal relief. She has not tried any over-the-counter medications. In addition to the burning, she reports increased urinary frequency and urgency. However, she denies fever, chills, nausea, vomiting, flank pain, or visible blood in her urine. To further evaluate her symptoms, I would ask additional questions about any vaginal discharge, itching, odor, or pelvic pain to help distinguish a urinary tract infection from vaginitis or sexually transmitted infections. I would also ask about recent sexual activity, the possibility of pregnancy, previous urinary tract infections, history of kidney stones, recent antibiotic use, medication allergies, and any chronic medical conditions. Collecting this information helps me narrow the differential diagnosis and guides appropriate diagnostic testing and treatment. Based on this patient's history, I would perform a focused, objective assessment of the genitourinary system while also evaluating for signs of a more complicated infection. I would begin by obtaining a complete set of vitals, paying close attention to her temperature, heart rate, and blood pressure to assess for any evidence of systemic infection. During the physical examination, I would assess her general appearance and hydration status before performing an abdominal examination, specifically evaluating for suprapubic tenderness, which is commonly associated with acute cystitis. I would also assess for costovertebral angle tenderness, as this could indicate upper urinary tract involvement such as pyelonephritis. If her history suggested a gynecological source of symptoms, I would also consider performing a focused pelvic examination. From a diagnostic standpoint, I would obtain a urinalysis to evaluate for leukocyte esterase, nitrates, pyuria, hematuria, and bacteriuria. Depending on the patient's history and risk factors, I would also consider obtaining a urine culture, particularly if she were pregnant, had recurrent urinary tract infections, presented with complicated systems, or failed initial treatment. Overall, combining a thorough history using the old CARTS framework with a focused physical examination allows clinicians to accurately identify the underlying cause of the patient's symptoms, develop an appropriate differential diagnosis, and provide timely, evidence-based, patient-centered care. Thank you, everyone. I look forward to learning from you all throughout this course.